Welcome to Eat for Life Nutritional Therapy. I'm Samantha Gilbert, founder of Eat for Life. I'm a nutritional therapy counselor specializing in a functional nutrition approach to healing thyroid disease. An estimated 200 million people worldwide have thyroid disease. Most thyroid conditions, especially subclinical hypothyroidism, often go unnoticed. Yet, if doctors used more comprehensive thyroid testing and functional reference ranges rather than overly broad lab ranges, many more people would be properly diagnosed with thyroid dysfunction. Most doctors rely almost exclusively on the TSH test to detect thyroid problems. Yet TSH isn't even a marker of thyroid function. It's a marker of pituitary function. Even worse, the medical community can't agree on what the normal TSH range should be. Thyroid dysfunction increases with age, and women face significantly higher risk than men, as they are 7 times more likely to develop thyroid problems. According to the American Thyroid Association, 1 in 8 women will experience a thyroid disorder at some point in her life. And women are 5 to 8 times more likely than men to be diagnosed with Hashimoto's thyroiditis, an autoimmune disorder that destroys thyroid tissue and accounts for over 90% of hypothyroidism cases here in the United States. Other thyroid disorders also affect women more frequently. Graves' disease, an autoimmune condition causing most cases of hyperthyroidism, is 10 times more common in women than men, with thyroid cancer developing 2 to 3 times more often in women than men. The thyroid gland may be small, but it plays an essential role in the body. Every cell has receptors for thyroid hormones, which means thyroid hormones influence every cell, tissue, and organ. In other words, a properly functioning thyroid gland is vital to overall health and well-being. Thyroid hormones work closely with other key hormones throughout the body, such as cortisol, insulin, estrogen, progesterone, and testosterone. Thyroid hormones affect brain development, pregnancy, gut motility, gallbladder and liver function, fat burning, insulin and glucose metabolism, body temperature, and cholesterol levels, to name a few. So if you're struggling with thyroid issues, please know you're not alone. You may feel stuck and confused by the overwhelming amount of information on how to feel better, but it's not just about hormones, and it's never a single issue. Common causes of thyroid dysfunction include chemicals in our environment, inflammatory foods like gluten, dairy products, and refined sugar, all of which can set up the entire mechanism of inflammation and autoimmunity and trigger leaky gut. Chronic infections also play a role, including Epstein-Barr virus, H. pylori, which is very common in Hashimoto's disease, parasites, and candida overgrowth. Even periodontal disease can cause your thyroid to malfunction. Other underlying causes include nutrient deficiencies like zinc, selenium, and iodine, as well as heavy metals like copper that interfere with thyroid hormone conversion. Very low-carb diets can also negatively affect thyroid function because the body requires adequate glucose to convert the inactive thyroid hormone T4 into the active form T3. The amount of glucose present in liver cells directly regulates the enzyme that performs this conversion. Because carbohydrates are the body's primary glucose source, extreme carbohydrate restriction can interfere with the T4 to T3 conversion process. In fact, research demonstrates that people following very low-carb diets often exhibit reduced T3 levels and elevated reverse T3 levels. In my clinic, I approach thyroid imbalances from a functional, holistic perspective. This includes appropriate lab work and a comprehensive plan to support gut and liver function, nutrient status, hormones, blood sugar balance, and biochemistry. I provide personalized guidance and collaborate with your medical care team when needed. My approach gives you clarity on the underlying imbalances causing symptoms, creates stability, and shows progress over time, all with a customized plan based on your unique needs. So if you're struggling with a dysregulated thyroid and many of the symptoms associated with it, such as hair loss, brain fog, fatigue, and anxiety, I encourage you to book a free discovery call with me to see how I can help you and if we're a good fit.